Now go to general adult tests. The topic is echocardiography. An echocardiogram is a heart scan that uses sound waves to create images of your heart on a screen. This is an excellent way for your doctor to assess the size of your heart, how efficiently it is pumping, and whether the valves are leaking or have thickened. A technician places a probe on the chest of a person having the echocardiogram and Doppler scan. The additional electrodes attached to the chest measures the heartbeat. An echocardiogram shows the 4 chambers of the heart, while the blue and red colors are the result of the Doppler ultrasound scan. This shows the flow of blood through the heart. The echo may show your heart is normal, which is very reassuring. It may also help diagnose heart failure, valve problems, and heart muscle disorders. Following the echo, you may be started on medication or be referred to another doctor for further testing. Thank you so much for your attention.
Let's now go to pathology. Let's discuss Qi stagnation. Qi stagnation is an extremely common pathogenic factor. Qi stagnation may be caused by emotional strain, irregular eating, excessive physical work, and lack of exercise. Emotional strain is the most common cause of Qi stagnation in Western patients. Some emotions such as anger, frustration, resentment, worry, and pensiveness may cause Qi stagnation directly. However, all emotions, even those that deplete Qi, may eventually lead to Qi stagnation. For example, sadness and grief deplete Qi, especially of the lungs. This will impair the circulation of Qi in the chest, and some Qi stagnation in this area will ensue. The chief symptom of stagnation is distension. English-speaking patients seldom use this term and will often describe this feeling as bloating. Distension may be experienced in the abdomen, hypochondrium, chest, women's breast, throat, and head. Distension is a subjective and objective sensation. Subjectively, the patient feels bloated, distended like a balloon. Objectively, the abdomen is distended, that is, protruding, rather hard, but also elastic like a balloon. Qi stagnation may also cause pain, in which case the pain is accompanied by a pronounced feeling of distension. Other symptoms of Qi stagnation include irritability, symptoms that may come and go according to the emotional state, a gloomy feeling, frequent mood swings, frequent saying, wiry pulse, tongue, body either normal colored or slightly red on the sides. Distension is the cardinal symptom of Qi stagnation. Other symptoms and signs depend on the organ involved. The liver is the main organ affected by Qi stagnation, and indeed, liver Qi stagnation is very commonly seen in practice. However, it should be stressed that other organs suffer from Qi stagnation, for example, heart, lungs, stomach, and intestines. It is important to note that Qi stagnation is a non-substantial pathogenic factor. In this, it differs, for example, from dampness or phlegm. For this reason, abdominal distension affecting the liver and the intestines is not relieved by the bowel movement. In contrast, abdominal fullness and pain caused by dampness or retention of food is relieved by the bowel movement. Remember, Qi stagnation does not affect only the liver. It may also affect lungs, the heart, stomach, spleen, and the intestines. Another important characteristic of Qi stagnation when compared to blood stasis is that it cannot cause any serious disease from the point of view of Western medicine. For example, Qi stagnation cannot cause cancer, heart disease, or stroke. In contrast, blood stasis is involved in all above diseases. Qi stagnation, the feeling of distension, distending pain that moves from place to place, mental depression, irritability, gloomy feeling, frequent mood swings, frequent saying, wiry pulse, and tongue, body either normal colored or slightly red on the sides. Thank you for your attention. Let's now go to Foot Yang Ming stomach meridian. Let's discuss stomach 11, Qi Cottage. In Foot Yang Ming stomach meridian, the location of stomach 11 is above the clavicle at the depression between sternohead and clavicle head of the sternocleidomastoid muscle. Stomach 11, Qi Cottage, Qi abode. This point lies in groove as one inhales, Qi passes down the throat to accumulate here. This point gathers together Qi and the nourishment of the Yang Ming and can strengthen the body, mind, and spirit when there is anxiety and weakness and when earth is undernourished and depleted. It is used to help coughing caused by countercurrent Qi. When supporting the earth element, will in turn support the lung. Ellis Weisman and Boss state that the functions of stomach channel points 11 through 16 and 18 are primarily associated with their location in relation to the chest and lung. The point names reflect these associations through the metaphor of the chest as a house. The house is a window, roof, door, and storeroom, while stomach 11 represents the abode itself. Indications: it nourishes the mind and spirit, or cup. For location, on the upper border of the clavicle, between the tendons of the sterna, the clavicular heads of the sternocleidomastoid muscle. To find, by rotating the patient's head in the opposite direction, especially against resistance, the ropey sternal insertion of the sternocleidomastoid muscle becomes clearly visible. Stomach 11 is located in a shallow depression, the minor supraclavicular fossa, between the sternal insertion and more extended insertion of the clavicular head. For needling, vertical point to 0.3 to 0.5 soon. For cushion, pneumothorax jugular veins. For actions or indications, it benefits the throat and neck and regulates counterflow Qi. Indicated if the throat is numbed or painful, for the local point for cough. Thank you for your attention.
Let's discuss liver patterns. Transverse invasion of hyperactive liver Qi. Concept due to an excess condition of the liver function leading to wood overacting on earth. Clinical manifestation, there is distending and wandering pain in the chest and hypochondrium, distension and pain in the breast, anger and irritability, digestive symptoms such as belching, vomiting, and bowel changes, wiry bowstring pulse. Liver Qi invading the spleen. Etiology, there is emotional strain, anger, frustration, resentment, irregular diet, overwork. Underlying accompanying pathology, there is stagnation of liver Qi, spleen Qi deficiency. Possible presenting condition, irritable bowel syndrome. Signs and symptoms, irritability, headache, bitter taste, oppression in the chest, hypochondrium. Abdominal pain, distension after eating. Excuse. Alternating diarrhea, constipation, stools can be dry and people-like or loose. Flatulence, tiredness. Pulse is wiry on the left and weak on right. Tongue is normal color or slightly red on sides. Treatment principle: calm the liver, harmonize middle burner, supplement spleen Qi, regulates intestine. Acupuncture treatment, we use bladder 20, regulates spleen. Liver 14 harmonizes liver and regulates Qi. Liver 3 harmonizes liver Qi. Ren 6 fosters original Qi. Spleen 15 moves Qi, regulates intestine. Sanjiao 6 regulates Qi, moves stool. Spleen 6 regulates liver, supplements spleen. Liver 13 harmonizes liver and spleen. Spleen 3 harmonizes central burner. GB34 harmonizes liver chi. Stomach 25 regulates large intestine. Ren 12 supplements spleen. Stomach 36 supplements stomach spleen chi. PC6 harmonizes the middle burner. Liver chi invading the stomach, etiology, states of resentment, frustration, and anger over long periods of time. Underlying accompanying pathology, liver chi stagnation. Signs and symptoms, hypochondrial or epigastric distension, sighing, hiccup, nausea, vomiting of sour fluid, poor appetite, aversion to food, diarrhea, dizziness, belching, churning sensation in the stomach, irritability, breast distension, and tenderness in women. Pulse is wiry, especially on the left middle position. Tongue, normal color, size may be red. Treatment principle is to calm the liver, harmonize middle burner, supplement stomach chi, regulates intestine. Acupuncture treatment, bladder 21, regulates center, harmonizes stomach. Stomach 36 supplements stomach and spleen chi. Spleen 6 supplements spleen, regulates liver. Ren 12 harmonizes the stomach. Stomach 25 regulates the large intestine. Stomach 21 harmonizes the middle burner. Needle with supplementation. Bladder 18 regulates the liver chi and blood. Liver 3 forces liver chi, subdues yang. GB34 courses the liver chi. Sanjiao 6 benefits lateral costal region. PC6 lowers rebellious chi. Liver 14 harmonizes liver chi in the middle burner. Stomach 19 lowers rebellion. Needle with drainage or even method. Relevant advice, a person with liver chi stagnation should, where possible, try and resolve any emotional causes of liver chi stagnation. They should avoid stress. Physical activity is beneficial because it circulates liver chi. People with liver chi stagnation may train a lot, which can be a conscious or subconscious form of self-medication. There is a risk that people with liver chi stagnation train excessively and end up weaken their blood and yin. It is important that the activities in which the person engages do not become chores that they have to do, as this will further stagnate the liver chi, their liver chi. They should eat a diet that tonifies and does not weaken the spleen. This entails eating warm, prepared food. They should avoid too much salad, raw vegetables, and fruit. They should also avoid sweets, sugar, honey, and artificial sweeteners. Dairy products create dampness and thereby burden the spleen, so they should be avoided. A person whose liver chi stagnates should try to avoid eating too much at a time or eating rich foods, especially concentrated proteins such as meat, dairy products, nuts, and food that has a high oil content, because this will create further stagnation. Aromatic spices, herbs, and foods that are slightly spicy will move chi, but they must be careful if these also have a warm or hot energy, because chi stagnation tends to create heat. Unfortunately, people with liver chi stagnation are often attracted to alcohol and spices such as chili, precisely because their spicy flavor spreads the stagnant chi, but this often results in the generation of heat. It is not only what is eaten that is important, but also how the food is eaten. It is detrimental to eat when a rush, while working, or while discussing issues that can stagnate liver chi. A person should preferably sit straight and upright while they eat and get some light movement, go for a walk or stretch after meals to support the spleen Qi dynamic. Alternatively, they can lightly massage their abdomen to circulate Qi. The person should also avoid food that has an ascending dynamic, for example, chili. They should also avoid eating food that creates food stagnation, eating too late at night, eating too quickly, or eating too much at a time. Stroking the fingers down the REN channel from REN 15 down to REN 9 after a meal can help descend stomach Qi. Thank you for your attention. Let's discuss inquiring, pain part 2. First, the chest pain is mostly seen in diseases of the heart or the lungs. Chest pain with inability to breathe and referral of pain to the shoulder or back is due to chest yang being suppressed. Internal blockage by a turbid phlegm or blood stasis in Qi deficiency. Any of these can lead to impeded flow of Qi and blood in the heart meridian. Chest pain accompanied by fever and labored breathing is due to strength heat in the lungs. Chest pain accompanied by night sweats and hemoptysis is due to deficiency of lung yin. Next is flank pain. It's common in illnesses of the liver or the gallbladder. Flank pressure and pain accompanied by sighing and irascibility is mostly due to trapping of lung qi or suppression of the passions. Flank pressure and pain accompanied by yellowing of the skin and sclera is mostly due to jaundice, which results from the chilling of the mixture of liver yin and dampness heat. Stabbing flank pain that is migratory is mostly due to stasis of liver blood and blockage of meridians. Burning flank pain accompanied by a flushed face and flame eyes is mostly due to trapping of liver fire, which then burns the meridians in the flanks and ribs. Burning flank pain accompanied by recurrent fever and night sweats is mostly due to deficiency of liver yin. Next is abdominal pain. Unrelenting abdominal pain that is alleviated by pressure is due to an illness of deficiency. Severe and constant abdominal pain that is aggravated by pressure is due to an illness of strength. Abdominal pain that feels as though cold and that is alleviated by warming is due to a cold disease. Abdominal pain that feels as though warm and associated with preference of cold is due to a heat illness. Abdominal pain associated with a mass under umbilicus that is movable signifies a collection of intestinal parasites. Distension and pain in the lower abdomen accompanied by loss of urination is due to blockage of the bladder outlet. Lumbar pain, aching lumbar pain associated with generalized weakness is due to kidney insufficiency. Cold pain and heaviness in the waist worsening on rainy days is due to dampness. Lumbar pain that is like pinpricks fixed in location and showing guarding and prevents turning or lying flat, prone, or supine is due to blood stasis. Limb pain, pain in the limb joints is mostly due to rheumatism and mostly caused by exogenous wind cold dampness. If the joint pain is migratory, it is migratory rheumatism and is principally due to exogenous wind. If the joint pain is severe, it is painful rheumatism and is principally due to exogenous cold. If the painful joint is heavy and immobile, it is severe rheumatism and is principally due to exogenous dampness. If the painful joint is red and swollen, it is heat rheumatism and is principally due to accumulated dampness in the interior transforming into heat. Next is total body pain. accompanied by fever, cold aversion, absence of sweating, and a floating and tight pulse is due to wind cold binding the exterior so that the meridians there are blocked. Total body aches accompanied by heavy limbs and pressure headaches as though squeezed is mostly due to dampness attacking the superficies. Total body pain from prolonged lying in bed because of chronic illness is mostly due to disharmony between qi and blood so that the meridians are blocked. Thank you for your attention.
Let us now go to interview and history taking strategies. The topic is components of the comprehensive health history. When writing down the chief complaint of a patient, use their own words to describe the reason for their visit. Ask the patient to tell you why they sought care. For example, Mrs. Brown, what brings you to the office today? Record the patient's response using her actual words. Do not rephrase the stated reason using medical terminology. For example, the correct way of saying it is, I've had a runny nose and sore throat for 3 days. The incorrect way is writing, patient states that she has experienced coryza and pharyngitis for 3 days. These data represent an amplification of the patient's reason for seeking care. The thoroughness and quality of the data in the history of present illness are the driving forces in determining which systems the clinician will focus on in the review of systems and subsequent physical examination. This judgment requires that the clinician think critically in analyzing the data and apply evidence-based research findings. The goal in obtaining the history of present illness is to get a comprehensive description of the characteristics and progression of symptoms for which the patient seeks care. For several decades, clinicians have used the mnemonic device PQRST to help ensure that all the necessary data are gathered regarding the patient's presenting symptoms. P is precipitating factors. What provokes the symptom? Q is quality. Describe the character and location of symptoms. R is radiation. Does the symptom radiate to the other areas of the body? S is severity. Ask the patient to quantify the symptom on a scale of 0 to 10, with 0 being absence of the symptom and 10 being the most intense. T is timing. Inquire about the onset, duration, frequency, etc. Although PQRST is useful in accurately describing symptoms, it does not capture many of the elements of health and illness as experienced by the patient. The following mnemonic device integrates ethnocultural considerations into the data gathering process and facilitates the provision of culturally congruent care. It also serves as a reminder to clinicians that patient outcomes determine whether an acceptable standard of care has been met. Successful outcomes are inextricably linked to care that is culturally and linguistically competent. The mnemonic device is client outcomes. C is character of the symptoms, including intensity and severity. L is location, including radiation if present. I is impact of the symptoms or illness on patients' activities of daily living and quality of life. E is expectation of the caregiving process. N is neglect or abuse, including any signs that physical and emotional neglect or abuse plays a role in the patient's condition. T is timing, including onset, duration, and frequency of symptoms. O is other symptoms that occur in association with a major presenting symptom. U is understanding or the belief about the possible causation of the illness or condition. T is treatment, medications, and other therapies that the patient has used to try to alleviate the symptoms or the condition. C is complementary alternative medicine, including a description of the patient's use of these agents or practices. O is options for care that are important to the patient. M is modulating factors, meaning factors that precipitate, aggravate, or alleviate the patient's symptoms or condition. E is exposure to infectious agents or toxic materials. S is spirituality, including spiritual beliefs, values, and needs of the patient. Thank you so much for your attention.
Let's now go to 5-element constitutional acupuncture. Let's discuss the use of tonification and sedation points. The use of tonification and sedation points. The tonification points are more frequently used than sedation points. This is because more emphasis is placed on tonifying underlying deficiencies than on sedating excess. Sometimes both points can be used together. If, for example, the liver pulse is full or in excess, and the pericardium pulse is deficient, then the sedation point of the liver channel, the liver 2, the fire point, can be sedated at the same time as reinforcing the tonification point on the pericardium channel, the PC9 or the wood point. This is most commonly carried out when an excess pulse is felt on the mother organ. The tonification point is used in preference to the sedation point when the mother organ is only relatively fuller than the child, but pulse diagnosis still shows it to be deficient overall. The use of these points is largely determined by which element the practitioner is focusing on in the treatment. If, for example, the practitioner is treating a water CF whose metal element is stronger than the water, it would be usual to use the tonification points of water, bladder 67 and kidney 7, several times during the course of the patient's treatment. It will be unusual to use the sedation points of metal large intestine 2 and lung 5 unless the organs of the metal element had an excess of Qi, which is unlikely. As you can see in the figure, the use of tonification points. On the other hand, if a practitioner is treating a wood CF with a full liver, it will be usual to use the sedation points of this organ, liver 2, especially if the heart or pericardium is deficient. It should be noted, however, that if the heart or pericardium were deficient in absolute terms, then it will be quite common to stimulate the tonification points of the fire organs, heart 9 or pericardium 9, if the stomach organ is full and the lung is deficient. Then the sedation point of the stomach 45 might be used. Again, if the lungs were deficient in absolute terms, then it will be quite common to stimulate the tonification points of the lung 9. And as you can see in the figure, shows transfers of Qi with emphasis on the sedation points, but tonification points can also be used. The principle is put succinctly in the ode to the streamer out of the dark. As to needling, the original channel, there is also the mother and child. Supposing the heart is weak, select little rushing in, heart 9, from the original channel and reinforce it. Little rushing in is the well wood point, and wood can produce fire. When it is strong, then select the spirit gate, heart 7, and drain it. Spirit gate is the shoe, earth point, and fire can produce earth. Thank you for your attention. Let's now go to erectile dysfunction. Let's discuss pathology in Chinese medicine. As you can see in the diagram, the pathology of erectile dysfunction in Chinese medicine. For MT, heart blood deficiency, heart and gallbladder Qi deficiency, kidney yang deficiency, liver blood deficiency, kidney yin deficiency all leads to impotence. As with full, the dampness, the phlegm, blood stasis, and stasis of essence all lead to impotence. We can identify the most common pathologies of impotence according to age. For age 20 to 30, it's dampness, heart blood deficiency, kidney yang deficiency, liver blood deficiency. For age 30 to 40, it's dampness, heart blood deficiency, kidney yang deficiency, liver blood deficiency. For 41 to 50, it's dampness, phlegm, blood stasis, stasis of essence, heart blood deficiency, kidney yang deficiency, and liver blood deficiency. For 51 to 60, it's phlegm, blood stasis, stasis of essence, kidney yin. For 61 to 70, it's phlegm, blood stasis, stasis of essence, and kidney yin deficiency. Unless for 71 to 80, it's phlegm, blood stasis, stasis of essence, and kidney yin deficiency. The main organs involved in pathology of impotence are the kidneys, liver, and heart. The kidneys are involved because they store the essence of the gate of the fire of the gate of life. The fire is involved in the pathology of impotence in two ways. First, its channels are all wrapped around the penis. Secondly, the liver stores blood and provides the blood necessary to the penis for erection to occur. The heart plays a role in erection in a similar way as it does for menstruation in women. Heart chi needs to descend to the penis and communicate with the kidneys for erection to occur. Secondly, heart blood also needs to descend to the penis and coordinate with the kidneys for erection to occur. Heart blood plays a similar role to liver blood in providing blood to the penis for erection to occur. In China, primary importance is always given to a kidney deficiency, and particularly kidney yang, as a cause of impotence. In my experience with Western patients in young and middle-aged men, heart pathology is a more common cause of impotence. This is due to emotional stress, causing heart Qi stagnation or heart blood deficiency, so that heart Qi and heart blood fail to descend to the penis, and heart blood fails to fill the penis with blood for erection to occur. In young and middle-aged men, heart pathology from emotional stress is a more common cause of impotence than kidney deficiency. There is heart Qi stagnation or heart blood deficiency, so that heart Qi and heart blood fail to descend to the penis, and heart blood fails to fill the penis with blood for erection to occur. In full conditions, erection becomes difficult because there are pathogenic factors obstructing the process that leads to an erection. Dampness and phlegm, usually deriving from irregular diet, obstruct the connecting channels of the penis and prevent erection from occurring. Blood stasis and stasis of essence, usually deriving from emotional stress or overwork, also obstruct the connecting channels of the penis and in particular the blood, the deep connecting channels, making erection difficult. Thank you for your attention.